Why does Black health matter?
Black Health Matters is so incredibly important because we need to be here and we need to experience life in all of its fullest. We need to thrive. We need to love. And all of that is possible when you have good health. It's the foundation for everything that you do.
Awesome, awesome. And what inspired you to create Black Health Matters?
Again, love. Having people that I loved in my family, my grandparents and other seniors just die too soon. Literally, no one making it to 70. People who worked and labored all of their lives, but never got a chance to collect retirement benefits. So in seeing that, I felt immediately, didn't have the words for it, but that there was a disparity, that something was existing, that my story was so similar to other people who looked like me. So when was this going to stop? And I was 17 when I experienced it, and that anger fueled my passion. And when the Affordable Care Act was enacted, and folks across the country, all people could have access to care, I felt this was the time to launch Black Health Matters so that we could be the North Star for a new way of thinking that science would be for us.
Awesome, awesome. How has Black Health Matters evolved since its conception? And what are some key milestones you've achieved? And you can restate the question for me so that people can follow along.
So what are some of the bigger milestones for Black Health Matters? There are so many. When I launched Black Health Matters more than 13 years ago, we would have events that would be free, where we'd have food and expert doctors, and we'd put them in a church in the Black community, and guess what? No one would come. We had a wonderful website with all of this insight-based content that spoke to chronic conditions that impact the Black communities most. I would share that content in specialty groups on Facebook, Black groups on Facebook, and those groups would report us to the Facebook gods, and we wouldn't be able to post content for another 2 weeks. So through trial and error, we started to understand that education and raising awareness was so much bigger than 1 or 2 articles. What we learned is that we have to really meet people where they are and not just expect there to be acceptance. So we kind of pulled back and we decided to grow slowly. And wherever we were invited to be, we would come, bring resources, bring physicians, and slowly but surely there's acceptance. So today we are at the Black Health Matters Summit at the Loudermost Center in Atlanta, Georgia, and I would have to say we have about 850 people here. And they're listening to expert clinical presentations. They're being screened for heart disease. They're getting vaccinated. And they're also getting screened for a metabolic test that's going to test them for 28 various conditions and provide them a booklet on their scores. So time has evolved, and we're excited to be a part of that change.
Awesome, awesome. There's a question I was going to ask you that came up and slipped away. It'll come back to me. How do you see AI and technology? I know I'm a certified drone pilot. I do a lot with AI, use AI in my productions and things like that, from pre-production to production to distribution and post-production. But how do you see AI and technology playing a role in the future of Black health and wellness?
So I don't have a real opinion on that.
And what is that when you speak of? So just kind of restate it, AI and technology.
AI and technology, we're basically using it more so to help us create plans of engagement to educate communities about chronic disease management, more or less as a checklist to make sure we've covered all bases, that we factor in churches, that we go to advocacy organizations and speak with them as we look to, educate on heart disease or kidney disease or mental wellness. So that's how Black Health Matters uses AI.
Good, good. And lastly, what partnerships and collaborations are you looking forward to in the future? I know we just spoke about the Health Film Festival is one thing. But what kind of partnerships and collaborations are you looking for in the future?
So partnerships and collaborations are completely in the DNA of what we do. We would be nothing without the community partners that we work with on a regular basis. Today at our health summit, we have more than 25 community partners here representing a variety of different disease states, whether it be the Allergy and Asthma Foundation, even AARP brings their own resources and their own audiences. If we are to tackle and dismantle the social determinants of health and how they impact Black wellness, we must come together, and community partners make that happen.
Awesome. Is there anything else you want to add that I didn't ask?
So in September, we're going to be launching Black Health Matters Month, which is a time for everyone to show up and do something healthy that they hadn't done before. We're going to have a full slate of activities, so you can look to us for to get in where you can fit in, whether it be a film festival with great films and documentaries, or screening programs, or fitness walks. We're just asking everyone to demonstrate and model healthy behavior for their friends, families, and neighbors. Because again, each one teach one, and as a community, we can thrive.